Hello, and welcome to another new student orientation webinar. So excited for those of you joining us. So excited for those of you watching us in the future. Before we get started with our lovely presentation, I want to start with a little introductory piece. We are here for another one of our new student orientation virtual webinar series. This is a collaboration between the Office of New Student Orientation, the Office of Admissions, and so many other offices that are excited to converse with you today. Couple reminders before we get started. The first thing is that we are still in our pre-orientation and virtual engagement stage of orientation, that phase one. And so if you have not already, I know many of you have, be sure to complete pre-orientation on Canvas. This course is going to introduce you to a lot of great things and help you feel prepared for your new student orientation experience. That is all available via your UNC admissions portal, which you should all be very familiar with at this point. Next, I want to remind you, if you haven't already signed up for new student orientation, I'm excited to say well over 1,200 of y'all are, but if you haven't signed up yet, we have plenty of space. And so we have in-person sessions throughout July, on July 14th, 16th, 18th, 20th, and 22nd. We have a virtual option on July 30th. And for any students who are having travel constraints, whether it's due to distance or many other reasons, maybe it's later admission, we have a last chance orientation on Tuesday, August 18th. If you're in any unique circumstances, maybe you live closer than 125 miles to campus, but you really want to attend that August 18th date, go ahead and reach out to us at orientation@unco.edu, and we are going to make sure that we figure out a way to get you into whatever date works best for you and any of your support persons. And last but certainly not least, we encourage you to join the conversation on Zeme. I know a lot of y'all are in this space having conversations with your fellow incoming bears. A lot of our orientation leaders are in that space, posting their life this summer on campus as we prepare to welcome you all to campus in just a few short weeks. So make sure you join us on Zeme. Make sure you're signed up for orientation, doing all of the pre-orientation Canvas course content. With that, many of y'all know this at this point, but my name is Pablo Valentin. I serve as the Director of New Student Orientation and Transition Programs. And I am joined today by Dr. John Hancock, who's here to talk to you about so many wonderful things around thriving and staying healthy and being well while you're at UNC. So with that, I'm going to give the reins over to my colleague, John here.
Right. Hey, thank you, Pablo. So excited to be with you, Pablo, and with our students this evening, including students who will be watching this at a later time. My name is John Hancock, and the answer is question, I guess, or answer is yes, I do get quite a few jokes about my name. But I give them out now as well as I can take them. So feel free to make whatever comments you want about my name. That's just fine. That's one question I get. Do you get comments about your name? The other question I get is about my job title. So here at UNC, I'm the Assistant Vice President for Wellness and Support. So you might ask, what does that sort of a person do? So I'll tell you that my background is I'm a licensed counseling psychologist, and most of my career has been spent around college mental health, particularly around college counseling centers, providing clinical services to students and working with other faculty and staff to lift students up, give them the mental health support they need, and ultimately help them on to graduation. In the last couple of decades of my career, though, I've done more and more things beyond just mental health. So here at UNC, I oversee a portfolio of programs that all contribute to students' health and wellness. That includes the health center and our medical center and our counseling center and other programs that we'll talk about today. So that's a little bit about what I'm going to talk about, and I'm going to bring my slide deck up and start talking with you. Most of my presentation today is pretty positive. It's about resources, right? About hope, about resilience. But I do want to acknowledge on just a slide or two that there's a lot of stress in the world these days. This was a survey the American Psychological Association does it every year. And you can see in 2025, youth stress had reached extremely high levels. We have lots of students screening positive for depression, lots of students reporting, regular mental health challenges, academic pressure, social media, and economic uncertainty. Lots of high schoolers feeling a lot of stress too. So we're sensitive to these issues at UNC. We want to do the best job of supporting students as they enter into the institution. So I normally kind of do something interactive, but given the focus of today's webinar, I won't make it interactive, but I'll ask you this. What do you think the top 3 stressors are for UNC students in terms of challenges that they're experiencing? And so I'll just give you a few seconds to think about that. And my experience is when I ask this to students who are incoming and their parents or families, a lot of them actually nail some of these, right? So, top three issues: loneliness, finances, and managing anxiety. Loneliness, we came out of the pandemic having more trouble connecting, and that's not just young people or college students, but it's the population more broadly. We know that college is expensive, food's expensive, housing expensive. We know our students wrestle with financial challenges. And lastly, managing anxiety, which can relate to all sorts of things, whether it's about anxiety being successful, anxiety about being away from home, anxiety about sort of managing one's own life independently for the first time, anxiety about relationships, and am I going to fit in here? So we know our students have lots of stress, and that's why we really give lots of thoughts and lots of resources to how students are feeling and how they're doing in their time at UNC. About 4 years or so ago, UNC adopted a formal partnership with the JED Foundation. The JED Foundation is one of the nation's leading nonprofit organizations dedicated to improving the mental health and well-being of adolescents, young adults, including college students, and also preventing suicide. So we've had a lovely partnership with the JED Foundation over the last 4 years, adopting best practices in concert with them around student well-being. And one of the ways we've sort of branded this here at UNC, we know that if we talk publicly about the JED Foundation, really nobody will really understand very much who that is or what it's about. So we talk about it in terms of UNC Flourish. Our goal really is that all students flourish at UNC. And we know sometimes it's not going to feel that way. We want to help them get through the tough times so we can get them back to flourishing. And so sometimes you'll see these sort of icons, this visual imagery in some of our programming around campus. And when I try to describe what the UNC Flourish culture is really about, it's about this. We all need to take care of ourselves. We all need to take care of each other. And within that framework, it's normal to be overwhelmed sometimes. The nature of college is to test students, right? To see what their limits are, to press them, right? Because that gives students feedback not only about their performance now, but what they might be able to accomplish in the future. In the context of that, everybody's going to get overwhelmed sometimes. That's natural. So, and we expect that all of our students have been probably overwhelmed at some times in their past life, right? However, sometimes that overwhelm lasts a long time. It's hard to get out of it. And or the overwhelm is so intense that it's just really unbearable. And for any of those kind of situations, we absolutely want students to reach out for help. Our mantra is it's okay to reach out for help here when you're feeling overwhelmed. And so that's part of what UNC Flourish culture is all about. As I talk with you today, I'm actually going to touch on about 7 different resources. We'll talk about our counseling center and the associated program for reducing gender-based violence on campus. We'll talk about our medical clinic. We'll talk about our health promotion office, our food pantry, our disability center, a relatively new office called the Center for Student Wellbeing, and then finally a little bit about campus recreation. So we do more around wellness at UNC than just this, but this is a fair amount of what we do, and hopefully we'll get an overview of the resources we have on campus. I want to start talking actually about after hours and emergency resources. So we have a lot of resources during the day, 8 to 5, Monday through Friday during the academic year for students if they have medical challenges or psychological challenges, emotional issues, whatever's going down. But if you look at the clock, on average, when students have crises, they might well happen after 5 o'clock at night, before 8 o'clock in the morning. They might well happen on a weekend or a holiday, sometimes when the health clinic isn't closed, the counseling center isn't closed. So to be sure that all of our students, as well as our parents and family members out there, are familiar with these resources. So first of all, for any imminent crises that students are dealing with, if you ever feel like there's an unfolding emergency, first call is our UNC Police Department, especially if you're on campus, right? If you're off campus, students, of course, can call 911. But the police essentially enact a 911 response here on campus for us. So they're your go-to if there's ever any issues of imminent danger going on. One level below that is, let's say you've got something medical going on and you definitely need help. And it's not a crisis, it's not an emergency, but you just don't want to wait till next day till the health center opens, right? So if you go onto the website for our university health clinic, you will find a web page dedicated to emergency and after hours care. You can see a little screenshot of it on this screen. Lots of resources there in the community that students can see and ultimately go to if they're feeling like they need help with medical issues outside of our regular work hours. Similarly, on the counseling side of things, new this fall, we actually have a new after hours crisis and consultation line for our counseling center. And you can see the number here on the screen, 833-862-3272. And that is a toll-free number. So this line has two functions. One, students can get 24/7 access to a mental health counselor on this line to talk about whatever it might be that's overwhelming them sort of after work hours. But also, if you're a parent or a family member or any sort of third party and you're concerned about a student, and it's not maybe an emergency, but you also don't want it to go too long, right? Maybe not till the next business day. You can call this line after hours on weekends, holidays, whatever, and you can get mental health professionally trained folks to provide mental health consultation for you about the student and what they might benefit from in the short term. Similarly, we also have a sexual assault crisis line. Of course, we strive to create an environment here where gender-based violence never happens. And we know that we don't control that entirely. So we want to be sure that anybody who experiences sexual assault, gender-based violence, domestic violence, dating violence, stalking, any of these things has access to support. And this 970 number on the screen is a great place for students to get that support. Now, maybe the help that you need, either as a student or as a family or parent, maybe it's not quite that urgent, but you just want to ring the bell and make sure staff at the college are aware of something that might be unfolding that could be concerning. So, strategy one, of course, always refer any student who's struggling to the appropriate resources on campus. So, I always say to students, I say, if you have a friend or a roommate or something like that who's struggling, talk with them and mention, a little bit about the counseling center. You've heard a lot about it, and it might be a good resource, right? That's a great way to refer someone to help. But sometimes you try that, it doesn't work so well, or maybe the person's really set against getting help and you're really worried about them, right? So the QR code at the bottom of this page will take you to the Share a Concern form that's on the Dean of Students website. Now that form, you fill out the form about the person you're concerned about. And you can put in your own name too, because sometimes we like to get follow-up information. But when you fill out that form, now that form's not going to be reviewed after hours. It's not going to be reviewed on the weekends, but it is going to be reviewed on business days that the college is open. So never rely on that form to relay information that's really emergent or imminent concerns that are going on, right? But if there's a serious concern and it can wait till the next business day for staff in our Dean of Students office to review the information, it is a great way, because then we assemble a team to think about the student who's maybe struggling the most and how do we support that student the best and get them the help we need. So all of those are sort of resources that you can turn to at times when maybe all campus offices are not open. So next up, I'm going to talk a little bit about health insurance. So make sure I've got my notes here. So I want to talk about, UNC does require health insurance for students, undergraduates who are taking 9 or more credits. I want to talk with you about why we do that, right? So one is that I've been around college health for many, many years. I've been in situations where a student didn't have the money, didn't have the resources to get the medical care they needed or the psychological care they needed. And so they didn't get it, right? And as a result, their situation got worse and worse to a point where they were facing perhaps a medical crisis. That's not what we don't want any students in medical crisis if we can avoid it. We don't want any students having any safety concerns if we can avoid it. So one of the ways we do that is we do require health insurance for all of our students taking 9 credits or more at the undergraduate level, so that they're more likely to get care when they need it. and we don't have those sort of safety concerns going on. But also so that if a student has a medical concern or a psychological concern, they can get help when the problem is smaller and avoid the possibility of having to do a semester withdrawal, which can get pretty expensive when you're doing a semester withdrawal. You're not getting any credits for a semester that you've been through. So having health insurance requirement is one of the ways we help students avoid those sort of medical withdrawals. Now, we do offer a student health insurance plan at UNC, and I'm going to talk about the student health insurance plan, but I want to be clear. You can have whatever health insurance you want at UNC. It doesn't have to be the student health insurance plan, right? So most of our students actually wind up having their health insurance be a plan that they have through a parent or a guardian or a family member or a spouse or domestic partner, something like that. And that's just fine. So, but the way our process works is that we do enroll all of our students taking 9 or more credits at the undergraduate level in our student health insurance plan. And I want you to pay attention to the red on this slide. The charge for that plan is $1,743 per semester. Now, how that works is that you pay that for the fall, you pay it again in the spring, and in the spring, 3 months of summer coverage is automatically added onto the spring coverage at no charge. So if you pay the $1,743 twice, once in the fall and once in the spring, you actually get 12 months of uninterrupted insurance coverage. Now, the carrier that our student health insurance plan uses is called Cigna. The plan, if you look at it on the Affordable Care Act continuum, it's a silver plan. That means it has a pretty robust set of benefits associated with it. It has a deductible of just $500. It has a pretty good system of copays and co-insurances. Every year, we work with the vendor to make sure the plan offers a really good set of benefits that are applicable to college students. So it's a real good plan. The Cigna network is a network that goes nationwide. So it doesn't offer, obviously, doesn't offer care at any provider in the country, but it has a very big in-network provider system where a student can get care on campus at the health clinic. They can get care in Greeley. They can get care in Colorado. They can get care nationwide, right? So it really is a plan that travels with a student very well. All that being said, if you have other coverage, you can waive out of our plan by doing a simple online waiver. It's done through My UNC. Now I say that, and I want to say if we have any international students watching the program today, your waiver process will go through the Office of Global Engagement. So the directions I'm about to give don't so much apply to you. But if you go to the QR code here on this screen, that will take you to our student health insurance website. And as long as you go to that website, our waiver will open on July 1st. As long as you complete that waiver and put your insurance information into our system by September 4th at 5 o'clock, you'll be golden. That the charge for health insurance will drop off of your bill. You won't be charged for that this fall, and it won't be on your bill in the spring either, right? But know that actually that waiver is required every fall semester thereafter this one. So just be sure it's not just a one-time thing. It's actually done once a year, and typically it's done in about August time when that waiver opens. Let's see. I think that's what I want to say about student health insurance. I will head on to the next slide here. Oh, one more thing about health insurance. This is new this year. So for people who are enrolled in our student health insurance plan, we really work to keep the costs down for that plan because that's how we keep the premium down for the plan, right? And so one of the things we're doing this year is we're actually having students go through our health clinic on campus if they want off-campus care, right? For most of the time, that's what we're requiring. Now, there are some exceptions to that. So you don't have to go through the university health clinic to get a referral for off-campus care if you have the student health insurance plan, right? If it's a medical emergency, although you do have to come back to the health clinic after the emergency is over for whatever follow-up care you need, right? You don't need to go through the health clinic when we're closed on breaks. You don't have to go through the health clinic if the care that you're getting is more than 20 miles away from campus. Also, maternity, obstetrical, and gynecological care, you don't have to go through the health clinic for a referral. And similarly, mental illness treatment, substance substance use disorder treatment, you don't have to go through the medical clinic for a referral for that, right? But be sure to go to the clinic if you've got student health insurance. In any other circumstances, that's the way you'll get to reimbursement for whatever claim is happening, right? I'm going to talk a little bit about immunizations. Now, used to be, I hardly had to say anything about measles, but now I have to say more things about measles. Measles is a thing across the US. We've had a dozen, I think, maybe a dozen, 2 dozen cases in Colorado, somewhere between that this year so far. So it's a real thing. So the state of Colorado does require all students turn in verification of 2 measles, mumps, rubella vaccine, or have an appropriate exemption form signed, right? So exemption forms and or doses of measles vaccination documentation, all of that gets uploaded through your admissions portal, right? Please be aware if some students can't get the MMR vaccine because, let's say, a medical issue, right? We understand that. We respect that. Public health has told us in the event of measles cases on campus at UNC, knock on wood, we haven't had any yet, but some of our other colleges in the state have had cases, right? But public health may actually require us to exclude students who don't have evidence of immunity to measles. That means either vaccination or maybe a titer test to prove that they've had the disease in the past. So just be aware of that. So exemptions are fine, they meet our criteria, but that might be an issue if we'd ever have measles cases on campus. And the period of exclusion for measles could be up to 21 days or longer. That's what public health tells us. So it can be quite a long period. So we do encourage as many of our students as possible to go ahead and get the vaccine. In addition, if you're a new student living on campus, you do need to show proof of meningitis vaccine or sign a waiver for meningitis vaccine before moving into student housing. Watch for your email coming up. You'll receive more information about that. Any additional questions about immunizations, please contact Deb Miller. Her information is on this page. She'll be happy to take care of you. I have one last thing to say about meningitis, and that is the requirement for meningitis vaccine actually is only to certain strains of meningitis vaccine, happens to be A, C, W, and Y. But there is another strain of meningitis vaccine, and it's meningitis B, right? Can be just as deadly as meningitis A, C, W, and Y. And so the American College Health Association actually gives really good, concise information about the full range of immunizations that it recommends for college students, right? UNC, we only require the two if you're living on campus, 1 if you're living off campus. So, but the American College Health Association actually recommends a number of them, including meningitis B. We encourage students to talk with their healthcare provider sometime this summer about the potential of meningitis B vaccine, as well as the other vaccinations that the American College Health Association recommends. All right. Moving on to our resources, right? So the University Health Clinic. When you think of the health clinic, think of a medical clinic. It's right here on our campus. They provide care for illness and injury, but they also do other things too. They provide x-rays, they can do allergy injections, chiropractic care. We even have a lab, so students who need blood draws, either on a one-time basis or at a regular basis, can come into the health clinic and get those blood draws. Most of our care is provided by nurse practitioners in the health clinic. One thing that I want to clarify, the health clinic does bill for the services they provide. So in that way, they're a lot like an off-campus urgent care clinic or something like that, right? So how much you pay at the clinic depends on what insurance you have, right? Whether we're in network with them or not. Something that gets kind of confusing is people think, oh, I declined student health insurance, therefore I can't go to the university health clinic. That's not true at all. We have a relatively small slice of our population that is enrolled in student health insurance, but we have a large slice of our population that uses the University Health Clinic. They take lots of different insurance, including Colorado Medicaid. So if you have any other health insurance, the University Health Clinic bills under the name of campus clinics. And so whatever health insurance you're considering having here at the college, it's a good idea to go onto the website of that health insurance and just see if Campus Clinics in Greeley, Colorado is an in-network provider with whatever health insurance you're thinking about, right? They are in-network with the Student Health Insurance Program. They offer a really good deal for a simple $20 copay. You can get, it essentially covers the cost of a provider visit as well as in-house labs that we run. And so it's a really good deal if you have student health insurance. But again, we take other health insurance plans. If you have a health insurance plan that doesn't work at the University Health Clinic, but you as a student, or if you're a family or a partner or spouse, whatever, you want your student to have access to services at the University Health Clinic, there is an option for that. It's called our Bear Care Plan. And if you'll scan the QR page code on this page, it'll take you to a page where you can learn more about the Bear Care Plan. With the Bear Care Plan, you can pay $199 at any time, and that will get you 4 provider visits in the health center whenever you need them, simple visits, right? And if you don't use those visits in a given academic year, they roll forward to the next academic year. You don't have to buy them at the beginning of the year. So if you want to not buy them to start the year, but maybe something comes up in February, and then you think, as a student, I really want to access the health clinic on campus, you can pay the $199 there for the Bear Care Plan, and then you'll have those 4 visits to work for you when you need it. Now, as I said, we do bill insurance for these services. We do have a limited pharmacy in the health clinic. It's not the kind of broad pharmacy you're going to find at Walgreens or other places off campus. But we do have very common medications that students need. We do not bill insurance for medications. We bill insurance for provider visits, not for medications. But we do offer the meds pretty much at our costs, right? So we're not trying to make money on the meds. They tend to be, fairly inexpensive, but we cannot bill insurance. So that's just a limitation of the services we offer. Let's see. One little tip I'll offer you from my own experience. When I sent my own 2 students off to college, they went far away from home. I chose to not enroll them in the student health insurance plan at the college they were going to. I kept them on my employer-based plan. But one of the things I did with them before they went away to college is I sat down with them together and we looked up on our insurance company website the names of in-network hospitals, in-network urgent cares, and in-network pharmacies that my students could access if they ever had a health problem arise after hours. And wouldn't you know it, during their college careers, both of them had health emergencies arise after hours. And because I had done that with them, they were able to look on their phone where I had them record this information, right? And they were able to seek out the urgent care, the pharmacies, the hospitals that were in network with our insurance. And the result, it saved us a ton of money. So I always encourage all families to do that, regardless of what sort of health insurance you're going to use. Let's talk about mental health for a little bit. So UNC, we have lots of different mental health resources for our students. This webpage with the QR code, you can find it through that QR code, actually brings all of our mental health resources onto one page. I'm not going to talk about all these resources today, but if you want to learn about all of these resources, this is a great place to do it. You can learn about them there. I'm going to talk next about our counseling center. So when you think about UNC Counseling Center, think about an organization that's focused on student mental health and well-being. A lot of students coming from high school will sometimes think of our counseling center and think of a counselor. Maybe in high school, a counselor was someone who helped a student sign up for classes, right? Or decide what college they were going to attend, perhaps, things like this. So at UNC, the counselors in our counseling center are actually all licensed mental health professionals, or they're students who are under supervision of a licensed mental health professional. So we have licensed psychologists, we have licensed social workers, we have licensed professional counselors, and they're there to help students in all the ways that a professional mental health counselor who's working off campus might help a student. So they're there to provide individual counseling. Most of our individual counseling is brief. So more of our students come in for 1 session than any other number of sessions, but our typical number of sessions usually is around 5. So the counselors are doing brief individual therapy, they're doing group counseling, they're if a student is concerned about another student, right, and wants to talk with a counselor about that concern, they can offer that kind of confidential consultation, which it can be really helpful. Our counselors are also really well connected to all the referrals off campus. So let's say a student comes in and it's pretty clear from the get-go they need more than the brief counseling that we can offer on campus. So the counseling center can refer them to off-campus care, including medication management, as well as psychiatry, as well as counseling and other related support services. We do offer both in-person and virtual appointments to the counseling center. We offer crisis and urgent care appointments every day. All of the services in the counseling center are confidential. Now, what that's going to mean for parents and family who might be listening in, right? There'll become a time in your student's career you may be concerned about them, right? Even as much as maybe you refer them to the counseling center, right? And the student comes into the counseling center to talk with a counselor, and then you want to know maybe how it went. So you call the counseling center up and you say, hey, I referred my student to come in. They told me they came in. Can you just tell me how it went today? It would really help ease my mind. Well, just to prepare you, what our staff are going to say is something like this. We're so sorry. We appreciate your concern. We can check if there's a release of information on file. But the only two ways we can share any information, even about a student who's just come in, even just that little sliver of information, the only way we can share that information is if the student has signed a release that gives us permission to share that information, or if it's an emergency and we need to share that information with you, right? So just be aware, this approach to confidentiality really helps assure students that what they share in the counseling center is going to be confidential, with some very small exceptions to that. So it generally tends to work in terms of helping students feel comfortable coming in for care. Now, all the services in the counseling center are free. The only thing we charge for is if a student doesn't show up for an appointment without canceling. We lose that appointment hour, so we have some modest fees for no-show visits. Now, we know that counseling center helps people with stress in all kinds of different ways. We know stress is not evenly distributed across the population of students at UNC, right? If you're a student who has a job, that's some more stress. If you're a student who has two jobs, that's more stress. If you're a student who's parenting, that's more stress. If you're a student who has had experiences with discrimination, okay? Maybe a student of color, perhaps, maybe a student who identifies as lesbian or gay or bisexual or transgender, right? So all of these students we know, depending on the amount of discrimination they experience, have more stress. So we really try to meet these students where we're at. So one of the things we do at the counseling center is we actually have some of our clinical staff outside of the counseling center at our cultural and resource centers on campus. We have it at our Marcus Garvey Center for African American and Black students. We have it at our La Casita is the new name of our center for our Latina students. We have a representative at our Center for Native American students and also Asian Pacific American students, as well as at our Gender and Sexuality Resource Center. At all of those resources, we have a counselor who goes out to these resources for a few hours a week and meets with students there. So again, we know stress isn't evenly distributed, but we really try to meet students where they're at, not just in the counseling center, but outside on campus too. I mentioned at the very beginning today just a little bit about the Assault Survivors Advocacy Program. We call it ASAP for short. ASAP really provides confidential 24-hour crisis response in any situations where there might have been sexual violence, sexual harassment, intimate partner violence, stalking, things like this. In addition, ASAP is also focused on preventing things from the beginning. So if you're a student, you're going to be hearing a lot about ASAP during your new student orientation and new student days. You're going to hear about the different workshop topics that we cover that are covered on this page. For any individuals who's a survivor of sexual assault, sexual harassment, intimate partner violence, and stalking, you can see some of the resources we offer. So for sure, emotional support, safety planning. We're working with off-campus referrals and hospitals, medical care systems. We're helping students understand what the reporting options are. And it's a confidential space, so students generally feel safe talking to our staff when they're talking with us about these things. And the ASAP program also offers opportunities for students to become interns and volunteers themselves. And we've had lots of students who, for example, are in our psychology majors here at UNC, or in our human services majors who actually get really great volunteer intern experiences through the program. So that can be another reason to keep the ASAP program in mind for a little bit later down the road. I'm going to talk next about our Health Promotion Office. So our Health Promotion Office focuses on providing education support resources about alcohol and drug use, about mental health resources, about sexual health education. We have wellness vending machines on campus. We help students identify and obtain supplies to support their sexual health and well-being. We have some naloxone kiosks on campus. So naloxone is a drug that reverses fentanyl overdose. So it's a real key part of harm reduction, of reducing the chance that anyone at UNC is going to die from fentanyl overdose. So that's another thing that the Health Promotion Office has going on. We also offer workshops in this office. We have peer health educators. And this fall, we have something very special coming out of this office. It's called the Radical Health Program. So I'm gonna check in with you for a little bit, Pablo. I've got a 3-minute video here, Pablo. Do you think I've got time to throw a 3-minute video? Pablo gives me the thumbs up sign, so that's great. The Radical Health is a program primarily for new students. It's designed to help new students connect with small groups of other new students, to make friends, to reduce loneliness, right? And in the process of doing that, over 4 weeks of meetings in the first part of the fall semester, right? Then we also include some information about skills for students. So what happens in these small groups, about 10 new students get together with 2 upper class peer leaders, and they go through a little bit of a curriculum. But again, the purpose is to build friendships, to build connections, and also to focus on the kind of skills here. I'm going to show you a video here that's going to take you to where I want you to go. Hold on just a second while I bring this up. Gotta move between my screens here. I'm almost there. All right. And here we go.
Each year, 5 million students start their college journey. What is supposed to be an exciting time is overwhelming for many of them. Students all over the country are experiencing record levels of anxiety, loneliness, and stress. The shortage of mental health counselors is making this situation worse.
Students want to connect, they want to tell stories, they want to share, and they want to see their experiences in other students.
In the fall of 2020, Radical Hope partnered with NYU to launch Radical Health. The 4-week program empowers young adults with skills and resources to strengthen connections and build resilience so they're equipped to cope before they reach a crisis point. Under the leadership of peer guides, participants meet once a week to explore self-care, active listening, time management, decision-making, and stress management.
When I listen to somebody else's story, share what the challenges that they have and the thoughts that they have and the fears that they have and the feelings that are coming up, it validates my own experience. So one of the ways to do that is to provide your friends and your teammates and the people in your dorm with the things that you want. Provide that safe space.
It really touches upon some of the fundamental needs that young people need right now, and that is with respect to connection, the ability to communicate, digging deeper into self and learning how to take care of themselves is really, really important during this developmental stage.
Radical Health gives young adults the tools to care for themselves, connect with others, and explore their place in the world.
It's really nice to build a tight-knit connection where everyone's super vulnerable and you just become friends on a deeper level.
With guys especially, we just don't really talk about those things. And I think that's something that needs to change. I think that's something that will change.
The purpose of those tools really come to life when they're discussing it, when they're sharing examples, when they're really demonstrating how they're putting those tools to use in their everyday lives. And that's where you see engagement, connection, celebration. You really see progress.
Thousands of young adults are participating in Radical Health. Through our partnerships across the country, we are growing our impact every day. Radical Health equips young adults with fundamental skills and a network of support that will serve them for the rest of their lives. With the support of generous donors, the Foundation fully funds the program for every partner. Join us as we work to strengthen connections, build resilience, and save young lives.
All right. So hopefully that gave you a sense of what the Radical Health program is all about. And I'm going to go back to my slide deck here. Pablo, slide deck now. Yep, excellent, good. So I think this program has great potential again. The groups are going to start in the fall around about the week of September 14th. So you are going to have a chance to come to campus and kind of feel your way through things and find your own space. But then starting the week of the 14th, they'll meet for about 75 minutes for about 4 weeks, 75 minutes each week for 4 weeks, right? Focused again on developing friendships and connections, and also a little bit on life skills too. So if you think you might be interested, this QR code at the bottom of the screen, you can go there and you can fill out a little interest form. Filling out the interest form does not lock you into being a part of the program. It'll just kind of get you on the mailing list for the fall, right? So we'll keep you posted on when the program's going to launch. And as you get closer to the fall and you're on campus, you can decide whether you want to do it or not. So super excited about that program out of our Office of Health Promotion. I'm going to touch real briefly on a couple more resources. And I think I skipped a slide. There we go. Hey, there's so much more about wellness and health at UNC. We have a wonderful campus recreation center. Student fees provide students access to that rec center at no cost. So it offers programs around fitness and wellness, including the rec center itself, gymnasiums, weight room. We have fitness studios. We have racquetball courts. There's pool access, fitness classes, personal training, lots of things going on there. We also have an outdoor pursuits program. We know that connection to nature is an important part of overall wellness. So we've got adventure trips going out in Colorado to do all kinds of exciting things through the course of the year. We've also got a gear shop where students can check out gear at no cost. We've got a climbing wall within the campus rec center itself. So we've got lots going out, and all that program is called our Outdoor Pursuits program. And finally, we've got a really vibrant intramural sports program and a club sports program. These are for students who didn't want to go and play varsity sports, right, but really enjoy playing sports on a more recreational basis. We've also got turf fields and grass fields. So just a lot going on when it comes to campus recreation. We understand the importance of that to health and wellness. The Disability Resource Center, I'm going to skip over pretty much today because our time is winding down. I'll just say we have wonderful staff in the Disability Resource Center. We can help students with accommodations if they're needing those for any sort of a disability, whether it's a temporary or a permanent disability. But it is really important to start early in this process, maybe even like this summer or before the start of classes, to make sure that if you're a student and you need any kind of accommodations, that all the paperwork's in place for that and you're ready to go in the fall. This next slide shows you the Disability Resource Center at UNC. They are going to be doing their own webinar on access and inclusion at UNC. And this is the QR code that will take you to the information about that webinar. So if you think you want more information about this resource, please check it out and attend that webinar. The last resource I'm going to talk about today is a little bit about basic needs. So did you know over half of UNC students report experiencing some degree of food insecurity in the last 30 days, right? Really a powerful stat. And we take this stat very seriously at UNC. So in the last few years, we've been very active at building our supports for students who are really quite economically vulnerable. And so part of that is our beer pantry and our other food security programs. we have a food pantry right here on campus. As I like to say, we like, for students who have plenty of food, right? We want them to come into the beer pantry to volunteer, right? But for anybody who doesn't have enough food, we want them coming into the pantry to get their 7 items a week at no cost, right? We know this can be episodic for students. Sometimes they have food, sometimes they don't. Anybody with a current beer ID number can come into the beer pantry. We recently rebuilt the pantry into a much larger space. It's in our university center. It looks a lot like a convenience store or a grocery store, right? We've really tried to take the stigma out of accessing a food pantry. We also have other programs to support food security for students that you can read about on the Beer Pantry webpage. We also have what's called our Center for Student Wellbeing. And so when you think about it, if a student is maybe needing food, they're probably needing other things too, maybe health insurance, right? Maybe medical care, maybe mental health care, maybe health insurance, maybe child care, all of these things that we would put under the category of basic needs, right? Or essential needs. And that includes emergency financial support. So we have staff from the Center for Student Wellbeing who can help students access all of these other resources, whether they're on-campus resources, off-campus resources, state or federal benefit programs. We have staff who can help students in this direction. And again, that QR code will get students to more information about these resources. And that's a lot in a little bit of time about our health and wellness resources at UNC. I hope all that's been helpful to you. It's been wonderful to be here to share this time with you. Thank you so much for your attention. I know that sometimes the questions about this sort of thing are more private, right? So I have an easy name to remember. We started with my name at the beginning, john.hancock@unco.edu. If you have questions about this and you want to reach out to me directly, that's cool. Or if you want to reach out directly to the other folks that I mentioned on the different slides that you covered today, that's fine too. So thank you. And back to you, Pablo.
John, great job. Thank you so much for sharing all of that incredible information. It really gets me so excited and warms my heart for all of the different ways that we try to care for our students here at UNC. And so thank you so much for sharing that information, students. You can reference this video whenever you need, right? So bookmark it, save it in a useful place, right? You never know if a few months into your semester, you're going to be like, I want to remember that. Know that we'll provide it in many other places, but what a great resource to get a nice, robust overview of all of the ways that we prioritize your wellness here at UNC. With that, like John mentioned, you can always reach out to them if you have questions on any of these things, or if you're not sure where to go, what's next, you can reach out to orientation@unco.edu. We thank you so much for joining us. We look forward to our next webinar, our next orientation, our next touch point with y'all. And in the meantime, we hope y'all are having a great summer. Thank you so much, and go Bears.
Go Bears.